What's going on, everybody? Today we're going to be talking about balance problems. If you're new to the channel, I'm Dr. Todd Strong, and I help people recover from neuropathy, gut health problems, weight loss. I do this both in my clinic here in Sarasota, Florida, and I do it virtually because we have online programs to help people out. But one thing that I see, especially with neuropathy, is that balance usually becomes a problem. Whether it's they're falling all the time, they're having to use canes, walkers, wheelchairs, assistive devices, whatever it may be. It's a really big issue that needs to be addressed. And a lot of people don't understand how neuropathy can cause balance problems, or they don't think that their balance problems are related to neuropathy, which I'm going to dispel that myth for you today and talk about why you're having balance problems, how neuropathy contributes to it, and what you can do in order to help restore this issue. So, with balance, it's like a three-legged stool. So you're probably wondering why I have this drawing up here. I did my best to make it look like a stool, so I'm not an artist, I'm a doctor, but hopefully you get the concept. Now, there are three systems that are responsible for your balance, and they are your feet, feedback from your feet, from the nerves in your feet particularly, the eyes, and the inner ear. And so your balance is very much like this three-legged stool. If you take out one leg of the stool, what happens is you get a two-legged stool. And that's not very stable. And this is why when people have neuropathy, if they have damage to the nerves in their feet and they close their eyes, they become even more unsteady because now you've got a one-legged stool. Or if they have damage to their feet and they have damage to the inner ear, then the only thing they're responsible or that's left is their eyes. If they close their eyes, they obviously fall. This is why when you do the one-legged stances, if you use a foam pad, if you have people close their eyes, then they become more unbalanced. You can tell, or you can use deductive reasoning to figure out which systems are being affected. So let's kind of work through this. Now, the feet are what send the nerves in the feet, the peripheral nerves, send signals to your brain telling you, hey, I'm stepping on carpet, I'm stepping on concrete, there's a curb, there's a lip, there's a dip right there. And it allows you to make adjustments for those things, because if I close my eyes, I can pretty much tell like what is around me, what type of surface that I'm on, which allows me to, make adjustments with my body, my posture, my muscle tone in order to compensate for those things. But if I don't have that feedback, which is called proprioception, and that's feedback from the joints in your feet, if I don't have that feedback, I can't tell, is my foot elevated? Is it rotated? This is why you'll see some people, they turn their ankles a lot, or they stumble a lot, or they drag their feet because they don't have that awareness. So whether you have like a diabetic neuropathy, lumbar-induced, chemo-induced, smoking, alcohol-induced, autoimmune-induced, what are other ones? A medication-induced neuropathy. If you get damage to these peripheral nerves, then the brain doesn't get that feedback. And what will happen is that over time, you'll notice that your balance will get worse and worse and worse. And this is why you see that peripheral neuropathy tends to get worse with time. And so people's balance problems will get worse with time as well, because the less feedback that they have, the higher the likelihood that they're going to fall. And a lot of patients that come into my clinic or I speak with virtually, it's that they've got to that point where they're scared of falling. Maybe they can't even drive. One of the things here in Florida is that there are so many car accidents, and it's because people can't feel. We have a very, an elderly population here, and they can't feel the gas or the brake pedal. We have patients that come into my clinic just because they've lost the ability to drive. They're scared to drive. I had one guy who he couldn't feel his feet, or he couldn't feel the gas or brake pedal, so he took his shoes off and he got stuck under the brake, and he couldn't hit the brake, and he ended up crashing, and whole big mess. So, it is a very common reality that these things happen, and we see it very often. But some people come in the office, and I'm amazed at how they got here, because they drove and they can't feel their feet. They can't perform any balance test, and I see it as a big problem. And another reason why we worry about your balance is because if you have a fall and you break something, the outcomes 6 months down the road aren't very good. So the mortality rate is very high for that. So that's why we need to address it before it becomes a big issue. So if you do have neuropathy though, and you want to learn more about it, there are some resources that I'll put below this video in the description, so you can go and check those out, or go check out some of my past videos. But this is one of the main reasons why we see that the feet get affected. Now, obviously, you can have traumas to the feet, like if something falls on your foot, or if you crush your foot, and then that can, or if you have surgery on your foot. Those are the traumas that can affect the feet as well. So, as you can see, there are many different things that can affect the feet. Now, the eyes, this gives feedback to the brain. So if I'm leaning this way, if I lean the phone and it looks crooked, your brain will automatically adjust and you'll get even with the horizon. So there are a few ways that you do that. You move your body or you move your head, and that's why you'll see people with head tilts, because it actually corrects the plane of horizon. That gets a little bit more complicated with eyes and brain issues, but it is a way that if you're becoming off balance. Your eyes will give you that feedback so you can correct appropriately. So this is saying that, hey, I'm tilting, I need to adjust my body posture and the tone of my muscles to correct that. The problems with this is that as you get older, is that cataracts can develop, and so you'll see that people who have neuropathy and cataracts, they're very unsteady and very unbalanced, and they usually have to rely on assistive devices in order to get around. And then visual issues, like I have one patient who has lost vision in his eye, or you'll see diabetic retinopathies a lot. So not only are diabetics at risk for losing their feet, but they're also at risk for losing their eyes. And so now that takes them down to this one-legged stool. So if they get an ear infection, or if they have any trauma to their head and they damage their inner ear or their vestibular system, they become very unbalanced and unstable, because now you've just got this one-legged stool. And while even if it's centered, it may balance, but any little push or tip can cause it to fall over. So keeping your eyes nice and healthy is something, and the great thing is there are plenty of surgeries and things that people can do now to help with cataracts, to help with visual issues, but it is something that you want to think about as you're aging, making sure that, especially diabetics, you got to keep those blood sugars below 140. Otherwise, it's going to damage the peripheral nerves in your feet, and it's also going to damage your eyes. So every time that blood sugar goes over 140, you're actually getting nerve damage, not only in your feet, but in your eyes as well. And then the last system, so this is system 1, this is system 2, and this is system 3. The inner ear, it's called the vestibular system, so it's those little crystals in your ear. What they do is they go directly into the brain to tell me, hey, I'm leaning back this way so that I can correct. And it's a really neat mechanism, because if I lean back like that, it causes you to contract the opposite muscles to bring you down so that you don't fall backwards. But you'll see that some common issues with this are like BPPV, which is benign paroxysmal vertigo. And so that's when the room is spinning or you are spinning and you just feel really off balance. And so, like I said, if you take away the feet and you take out the inner ear, and then, even if the inner ear, if you have this BPV, it's going to affect your eyes. And so then you become even more unstable. Meniere's is a very common one. This is typically due to a viral infection, like swimmer's ears, why you see that. Traumas to the head can affect your vestibular system, and then infections as well in that vestibular nerve or in the inner ear can cause that system to be compromised as well. So the question is, what do you do for these? Well, peripheral neuropathy, you have to figure out what's causing it first. And like I said, I have a masterclass below that goes through the 7 biggest reasons why you have peripheral neuropathy, and how to address it, even if your doctor told you that there's nothing that you can do. They only give you medications or tell you to learn to live with it. There are things that you can do. For most people, some cases you can't, but you can go and learn what those things are and how we address it from a more natural standpoint. So a lot of things, obviously, you have to control the diabetes. You got to stop smoking and drinking if you're doing those things. You got to look out for any medication-induced neuropathies, restoring blood flow using laser, light therapy, shockwave therapy, oxygen therapy. There's a lot of things that you can do. The eyes, vitamin A is really good for the eyes, making sure that you're cutting inflammation out of your diet. Dairy, soy, sugar, especially diabetics, keeping the blood sugars below 140 is very important, especially for the diabetic retinopathies. And then the inner ear. So if you do have like vertigo, BPV, Meniere's, you can do things like, what are they called? You can do Brant Daroff exercises. You can do some vestibular training at home. You can work with physical therapists to help with those issues. This is more you probably need to work with a professional. The Brant Daroff exercises, that's spelled Brant, so B-R-A-N-D-T and then D-A-R. You can YouTube these, but these are just vestibular exercises that you can do in order to help with the crystals in your head. They work really well. That's what I tell everybody to do. We see good results with it. You just have to stay consistent. But the inner ear, like I said, those are good, but you probably need to work with a professional if you're having those types of issues, and just make sure that it's nothing more severe. So hopefully this was helpful. Hopefully it helps you all understand this whole balance system and the problems and why you're having balance problems, what you can do, and to make sure that you can't fall, or if you are a loved one, is suffering, send them this video so that they can understand what's going on with them better as well. So thank you so much for watching. Comment below if you have any questions. Please subscribe and like the video if you found it was helpful, and I will talk to you all soon. Bye.